government of Uganda recognizes that its population is its most important asset and an integral part of development. According to the 1991 census, females constitute 51% of the population in Uganda. Uganda's maternal mortality is estimated at 500 deaths per 10,000 live births. The health of mothers and children in Uganda is adversely affected by higher fertility, which manifests itself into many births too early, too frequently, or too late. Gender disparities, access to education and economic opportunities hamper the independence and development of women in Uganda. Since the Cairo International Conference on Population and Development in 1995, the welfare of mothers and the reproductive health rights of the girl child have come into prominence. According to the 1991 Population and Housing Census, Uganda's infant mortality rate stood at 122 deaths per 1,000 births. In Uganda, studies have revealed that 60% of women have had at least one pregnancy by the age of 18.
Previously, before Cairo, before 1994, the population programs tended to concentrate on demographic factors, on, as it were, population control. But after Cairo, we realized that we needed to chart a new course. We had to learn from our weaknesses in the past and draw on our strengths and move forward. And in particular, in Cairo, it was a consensus that the people must be at the center of population and development programs and activities.
Early childbearing encourages school dropouts and acts as a hindrance to women's educational and social economic development and the rights of the girl child.
In our context, 47% of our population is below 15. And you can imagine if these are the same people who are not employed, these are the people who are going to get involved in risky behavior, and you know, you can see what future we have, or what sort of generation do we have for the future.
When you talk about the youth in this country, you're talking almost about 50% of the total population. If you look at it very carefully, the economic base cannot actually support this kind of group in the long term, if you're talking about the formal sector.
Yeah, for the girls in Uganda, I think the main problem is to do with the way we've been socialized. And because of the way we are socialized, we grow up being submissive. We grow up knowing that we don't have to reach very far in life as long as you can get married. Whatever you do, you have to do it so that you can get the qualifications for marriage. And this tends to limit someone's future aspirations.
Recent surveys indicate a strong linkage between lack of education and early childbearing. It is recognized that Uganda's high fertility, maternal morbidity and mortality rates are due to the low socio-economic status of women. Recently, the government of Uganda has embarked on an ambitious program to ensure safe motherhood for mothers and the promotion of reproductive health rights of the girl child.
Transportation is a problem. The common transport we use here, we use our local ambulances, the ngozis. That's where they put patients, they carry them, and they bring them to our health unit. We also use bicycles. Those are commonly the ones people use in bringing patients here to the health unit. For us as workers, we see that we still have problems, especially we don't have radio links to the main hospital, so that maybe we could just request for an ambulance. And we don't have telephones.
We recognize that in terms of health of mothers and children, the quality of care is still a problem. this must also be tackled. We also recognize that part of the problem why we have such high infant and high maternal mortality is because of lack of an effective, sustainable referral system. And again here, we have made some efforts to make sure that we revitalize the referral system that used to exist in this country that unfortunately collapsed during the difficult time.
The government, with the assistance of UNFPA, has launched a pilot project, acronymed RESCUER, which strives to reduce maternal mortality by improving the referral system in Iganga district.
We have a very big district with a few referral hospitals, and therefore many of the mothers are deep in the villages.
The RESCUER program, which is Rural Extended Services for Care and Ultimate Relief, is really a principle of reviving the old system of referral system for women who may need emergency when they are in pregnancy or during childbirth. And we have piloted this project. We have had 3 components. It has a component of making sure that you have services which are functional at the healthcare unit or at the hospital, but you also have transportation, which is sustainable, simple transport that is able to transport a woman who needs assistance during pregnancy and childbirth. But we also make sure that we have a communication system whereby wherever this woman is, whether in the village or at the health unit, they can be able to communicate with the next higher area so that the other side is ready.
We are on the way coming to collect her, okay?
We use our tricycle, whereby the midwife goes with the driver in the tricycle and picks that patient, and the midwife moves with the bag equipped with all instruments and medicine which may be necessary for her to use. Since we received this referral system, so many mothers have appreciated it, because first on the side of the traditional birth attendants, knowing that they have the communication system to health workers, most of the patients were really coming to the TDAs, and they told us that really we are getting very many patients now. So at least with the radio system, that's fine. Also with the tricycle, now that anytime when they call in we can't reach, at least they have appreciated. That's why at least now they have trust in us. And even now that we had this training to our staff for the Lifesave Network, at least they have very great improvement now in serving the pregnant mothers. And we have very few complications, less complications in this area now.
In case of complications, an ambulance is dispatched from the district hospital to the concerned health clinic or center to collect the patient. While en route, the woman in labor is cared for by qualified personnel. The radio communication link between the ambulance and the hospital ensures that duty personnel are on the spot to admit the woman in labor for timely and often life-saving examination by a doctor.
far as this case has been, it was successful. We happened to deliver a live baby, score 10. The condition of the mother is also stable, and we have taken her back to the ward for further management.
Nali itando waliragawa lukowe nabeyo yanemerera yansindikira abasawo abebugono bankolako bona bajobona nga tebali kusobola mukyala Kasuubo yawandiika ebbaluwa yakokatire kanfuweevu iganga yantama mu motoka ambulance yantuusa wano.
The referral system has helped really to integrate the management of obstetric emergencies.
We have seen it reducing actual death in these areas where it is being piloted right now.
Era babanga mukulu n'omuto bali bulungi. Kale era emirimu gya kuno ngiboine nti mirungi n'abantu baaku tukolera alala era nebaza ne gavumenti olw'okuba nti yatuwa emirimu gino okuyamba bannaifwe kubanga kituirewo okufa okunene nga bwe twalingeera ng'abakyala bwe baba nti balumwa batera okufa.
We have normally had to train and equip both health units and the hospitals, make sure they have equipment ready to deal with these emergencies, and that the staff there are properly trained to be able to handle these emergencies. Those who have got basic education, we give them refresher courses, and we also make sure that we motivate them to know that they are going to have to deal with these emergencies. They must be there all the time, and they must be able to move, to have life-saving skills to be able to handle these situations.
The exercise also involves upgrading of skills of traditional birth attendants, who are usually the first contact point most expectant mothers make all over Uganda.
Che ko namba che sita kanye chawe ngana ile lo mungi le kwet ko to nyoru nga gur na sila che mi ku munye ber cha gasla mi ku munye le bas kin changa ra kan che sono kapsa ago e sawe nyo ki ji bor bole min da ku bur che sha ku bok poshet nyo gi yimbale ko ye go ne sawa na manana ye ni che sana sawa na manana de ga gasla ka get yo lo kotti le kwete nyo tagroria ka sanyo kapsale Viendi ni nyo sana manana bare kas ndenye ta tombale ta sana ka impik sana kun nde ke kaslet ta ku loye ngale agotte kini jota je changre gnan ko tamni kimanga tan yota jota je kita shige ngom na ne.
Another initiative to ensure safe motherhood is the Marie Stopes Clinic.
Marie Stopes actually is a one-stop center for all reproductive health services. By and large, what we talk about is comprehensive family planning services, both temporary and permanent methods, what we call counseling, treatment of sexually transmitted diseases and infections, counseling of HIV/AIDS. We also handle cases of infertility, not quite common though, but very common. We carry out pap smear tests. What we do in Marie Stopes is that, yes, we do these basic curative services, but we use them actually a recruitment point. After you have treated this simple ailment, when this client comes back for a second visit, it's more friendly now, he's happier because the general ailment is going down. And it's now a point of when you've said, oh, look here, I think you're getting well, it's fine, you'll be fine. But come to think about, excuse me, have you heard about family planning? Have you heard about sexually transmitted diseases and infection? Have you heard about HIV/AIDS?
The government of Uganda recognizes that men are an integral part of behavioral change initiatives in Uganda. The clinics also target men specifically as agents and beneficiaries of social, economic development and behavioral change. The government of Uganda recognizes the importance of sensitizing men on gender issues and the promotion of the health of their spouses and children. It is crucial that they be knowledgeable and informed on sexual and reproductive health if the campaigns to ensure safe motherhood are to succeed.
Maristops came in actually as a government call to come and complement its effort in providing family planning services to the nation. Remember in 1991, the president of the country, His Excellency Yoweri Museveni, openly came and said that the country rate of population growth was so high that it was not possible to match that high growth rate with economic growth. So this is really why we came. And we consider ourselves and the work we are doing as part of the national, comprehensive national population and reproductive health strategy. We are not operating in isolation. The problem with the men has not been because they don't want to participate or they don't want to get involved. It's not that they're irresponsible. The problem is that they have not been targeted like people who actually have got special reproductive needs and rights. So when we started this idea of vasectomy and trying to promote it, we then recognize the fact that if you have to promote it effectively, then we have to develop specific messages for men that addresses the problem, the misconception, the rumors. We started explaining what vasectomy, and quite many men actually thought we should have been crucified. I mean, how do you start talking about something of the nature? How do you start controlling a man's sexual and reproductive rights? Well, as time went, we started developing specific programs targeting men and demystifying the misconception. The problem has been that men themselves have never conceptualized or got to put themselves into the shoes that they themselves also can play a leading role in decision making as far as some of these methods are concerned. But after they have discovered, they've started being comfortable. The number of men who come for condoms have gone up. The case of the vasectomy is really an amazing trend in the country, and I must tell you, I'm very happy. The men of the Ugandan men are not the type of men whom I think people say, well, I mean, you talk to men and they can't. No, they respect and they listen.
We have also tried to learn from the experiences of other countries, especially in the African region, sub-Saharan Africa. And I think also that has India does very well in making sure that we don't reinvent the wheel. And so we've been able to move. But I must say that it hasn't been easy either.